Hello, welcome to our next episode on kidneys failure education. You can check our previous videos if this is your first time of watching this channel. Let's continue from types of kidney failure, acute kidney failure, AKF, sudden loss of kidney function, often reversible if treated promptly, common causes, severe infections, dehydration, trauma, drug toxicity, or blockage of the urinary tract. Chronic kidney disease, CKD, gradual loss of kidney function over months or years, often irreversible, common causes, diabetes, high blood pressure, chronic infections, or inherited conditions like polycystic kidney disease, acute kidney failure, AKF, also known as acute renal failure. Occurs when the kidneys suddenly lose their ability to filter waste, regulate fluids, and balance electrolytes. It can develop within hours or days and is often reversible if treated promptly. Below are the main causes of acute kidney failure, categorized based on the site of dysfunction. What are the causes of acute kidney failure? 1. Prerenal causes, reduced blood flow to the kidneys. These are conditions that reduce blood flow to the kidneys, leading to inadequate perfusion, severe dehydration, due to vomiting, diarrhea, excessive sweating, or lack of fluid intake, shock, caused by trauma, severe infection, sepsis, or anaphylaxis, heart failure, poor pumping of blood. Reduces kidney perfusion. Low blood pressure, hypotension, from bleeding, burns, or medication side effects, blood clots, in major arteries supplying the kidneys, liver failure, hepatorenal syndrome, decreased blood flow due to severe liver disease. Before we continue, if you happily enjoy the video so far, hit subscribe and don't forget to turn on the notification button. 2. Intrarenal causes, direct damage to the kidneys. These involve damage to the kidney structures, such as the nephrons, acute tubular necrosis, ATN, commonly caused by prolonged lack of oxygen or exposure to nephrotoxic substances, infections, kidney infections like pyelonephritis or systemic infections leading to inflammation, toxins and drugs, antibiotics, e.g., aminoglycosides, NSAIDs, chemotherapy agents, or contrast dyes used in imaging tests, autoimmune diseases, conditions like lupus or vasculitis causing inflammation of kidney tissues, rhabdomyolysis, breakdown of muscle tissue releasing myoglobin, which can clog the kidneys, hemolysis, breakdown of red blood cells, releasing hemoglobin that damages the kidneys. 3. Postrenal causes, obstruction of urine flow. These occur due to blockages in the urinary tract that prevent urine from leaving the body, causing a backup into the kidneys, kidney stones, large stones obstructing the ureters or bladder, enlarged prostate, common in older men, leading to urinary retention, tumors, in the urinary tract or nearby structures compressing the kidneys or ureters. Injury or trauma, damaging the urinary tract structures, ureteral stricture, narrowing of the ureters due to scarring or congenital defects. 4. Other contributing factors, sepsis, a severe systemic infection causing widespread inflammation and reduced kidney perfusion. Burns, lead to significant fluid loss and shock, impairing kidney function, complications of surgery, especially cardiac or abdominal surgeries with a risk of reduced blood flow, severe allergic reactions, anaphylaxis, cause sudden drops in blood pressure and blood flow to the kidneys. I will still urge you to subscribe to my channel for more health education like this, and thank you for watching. See you for our next episode.